All right. Good afternoon. I'm Dr. Amy Gordon Bono. I'm a primary care internal medicine physician practicing in Middle Tennessee. I also hold a master's of public health. And today I'm joined by three fellow Tennessee physicians who battle against COVID on a daily basis in their ERs and ICUs, alongside brave nurses, respiratory therapists, and hospital staff. Typically, the start to these events involves some bad numbers and scary slides about how coronavirus is worsening in Tennessee. And yeah, there's no denying it's bad. It's the worst it's ever been by many metrics. But I guess folks, including our Tennessee governor, just don't really understand those numerical concerns. So today, you're going to hear what's weighing heavy on the hearts of your Tennessee doctors. These physicians will be sacrificing their Thanksgiving holiday to help fight this public health crisis. Some numbers I will share with you. Currently, Tennessee is reporting about 46 coronavirus deaths per day. More than 1,900 persons are currently hospitalized with the virus. The average test positivity rate is above 13%. These metrics are the highest on record to date. If 46 Tennesseans die every day, that's coronavirus taking almost 2 Tennessee lives every hour in our state. That's like someone's parents dying every hour in Tennessee. We physicians are coming together trying to make our collective voice heard. We are frustrated by several Tennessee elected leaders. We plead with our governor to issue a statewide mask mandate. We have asked for leadership to develop a coordinated Tennessee plan. In denying such requests, we feel abandoned by our elected leaders. We are disappointed in some of the behaviors of our fellow Tennesseans. And we are worried about the health and safety of our patients, our families, and ourselves. At this critical moment of skyrocketing COVID case counts, we question the strength of our healthcare systems and the resilience of ourselves in the face of adversity. You know, the adversary should be the virus in our midst, not each other. But leaders at a variety of levels have failed to frame the conversation appropriately. And in my mind, you know, infectious disease shows just how interconnected we really are. And during a crisis, we need unity, not division. So just as leaders disregard the scientific evidence for masks and mask mandates, we healthcare workers feel ignored by some of those in power. And what's worse is knowing that some of our fellow citizens and patients would abandon that same scientific knowledge and ignore our medical advice. And in the process, throw our healthcare workers and healthcare systems under the COVID bus and deny helping us, your neighbors, during a crisis. The hard work and sacrifices that are needed to guide us out of this pandemic are immense, but we can do this together with a coordinated plan from the top down. So we question, how can you help your neighbor? Well, how about we start with listening? Listening to the experiences of three Tennessee physicians, Dr. Jessica Rosen, Dr. Katrina Green, and Dr. Matthew Semler. They will be working this Thanksgiving holiday, caring for COVID patients in the ERs and ICUs stressed by uncontrolled community spread of COVID in Tennessee. So first, let's hear from Dr. Jessica Rosen, who will be spending the Thanksgiving holiday in her emergency department. Dr. Rosen, please share your experiences.
Thank you so much, Dr. Bono. Hi, my name is Jessica Rosen. I have been a practicing emergency physician here in Nashville for over 10 years now. And my husband, who's speaking later, is an ICU physician currently working in the COVID ICU. I am speaking up today because COVID-19 is already completely out of control in our state. And with Thanksgiving approaching, I'm feeling very worried. I'm worried that our hospitals, many of which are already full and suffering staffing shortages, will be overwhelmed in the next few weeks. I'm worried that we will be stretched beyond our capacity to manage not only the critically ill COVID patients, but also all the other illnesses that come into our ERs. I'm worried about the prospect of having to decide who to resuscitate based on limited resources. I'm worried about the increasing number of difficult conversations we'll be having with patients and their families in the weeks to come. Just last week, I took care of an older man who had recently traveled to Florida to visit his family who'd been missing him, where he unfortunately contracted COVID-19. He came into our ER with very low oxygen levels, obvious difficulty breathing, and chest pain. He had a large pneumonia on his chest x-ray. After stabilizing him, I admitted him to the ICU and then proceeded to talk on the phone with his very concerned wife, who was waiting in the car outside the ER. Every time I talk with the families of COVID patients, I can hear the pain in their voices at not being able to be with their loved one during this critical time, and my heart hurts for them. It is a terrifying experience, not only for the patients themselves, but for the families as well. I understand that the pandemic doesn't always seem real to people who are not on the front lines every day or who haven't been directly affected by COVID yet. But COVID is real, and we are at a crisis point right now. We are seeing more and more COVID patients and sicker COVID patients every day, and our hospitals are filling up quickly. As Dr. Bono said, I'll be working in the ER on Thanksgiving Day, so my family and I will celebrate on Friday, but we'll be celebrating differently this year. We're not traveling anywhere. We're getting together only with a small group of people and eating outdoors and socially distanced. We'll have separate serving dishes per household, and we'll be wearing masks when not eating. We will be making these changes and sacrifices to protect the health of my parents who are in their 70s, as well as our community at large, because we understand that the way we personally choose to gather over the holidays affects everyone else. I'm pleading with Tennesseans today to please consider carefully your Thanksgiving plans and prioritize protecting your loved ones from contracting this terrible virus. Don't travel if you don't have to. Consider gathering outdoors. Wear your masks and keep social distance. Yes, this year will look different, but we can make this sacrifice in order to stay healthy and hopefully have a more normal Thanksgiving next year. Before I end, I'd also like to appeal directly to our leaders to step up immediately and do your jobs. And that starts with clear and unequivocal leadership from the governor's office. We need to join the many other states across the country in enacting a statewide mask mandate, because masks do protect all of us, and they are the best evidence-based way to prevent transmission of this virus. We need enforcement of the Tennessee Pledge, mandating businesses to require 6-foot social distancing and masks. Recommending and suggesting just hasn't worked. We need more resources directed towards testing, and test results need to be available within at least 24 hours. Governor Lee, we can't do our job until you do yours. No parent, teacher, business, or community should have to fight a global pandemic on their own. Your everybody fend for yourself approach has failed. You must take responsibility and issue the mask mandate that doctors across Tennessee have been saying we need for months to get COVID under control, so that we can safely keep our schools and businesses open and avoid any further exponential spread of this virus that is already straining our hospitals and taking thousands of Tennesseans' lives. Thank you.
Thank you, Dr. Rosen, for sharing your experiences and providing us with your recommendations. We will now hear from Dr. Katrina Green, who will be working in the ER as well. this holiday season. Dr. Green, please provide us your comments.
Thank you, Dr. Bono. I'm Dr. Katrina Green, and I've been practicing medicine as an emergency physician here in Nashville for the last 9 years. Like Dr. Rosen, I too will be working in the emergency department during Thanksgiving weekend. My husband and I have made the very difficult decision to stay home and not visit family on Thanksgiving Day. Instead, what we've chosen to do is order takeout from one of our favorite restaurants here in Nashville that we want to support during the pandemic. This is a tough year for everyone, and we will miss being together this holiday with our parents, siblings, nieces, and nephews. But I'm exposed to this virus at work nearly every day, thankfully with adequate PPE. But despite that, I'm still terrified of infecting one of my loved ones. So this year, we will see our families from the safety of our computer at home. I wish everyone would think long and hard about their Thanksgiving plans and how they might be contributing to the spread of COVID by traveling or getting together in groups. COVID is everywhere. It's in every county of our state and every state in our country. Almost every day we break another record for total patients hospitalized for COVID here in Tennessee. The healthcare system here in Tennessee is already under enormous strain, and I'm not the only one concerned about what things will look like in our hospitals 2 weeks after Thanksgiving if it's already this bad now. My hospital and pretty much every hospital in Nashville is either full or very close, and that impacts how we operate in the emergency department. If hospital beds are filled to capacity, we have nowhere to move patients who need hospital admission. That means we hold those patients in the emergency department and have less rooms free to care for walk-ins and other emergencies such as heart attacks, strokes, or traumas. Lately, we've seen our waiting rooms fill up with patients waiting hours to be seen in a treatment room, many of them likely infected with COVID, which unfortunately places all of the patients in our waiting rooms at risk. We are worried about what the delays in care will mean for our patients, and I am personally terrified that my hospital being full could result in someone dying in the waiting room. This pandemic has taken a toll on me and my colleagues, not just physically, but emotionally. It's as if we live in two separate worlds. There's the world inside the hospital where we see patients coming in gasping for breath, their lungs full of infection. And then there's the world we see outside the hospital, with people not wearing masks, eating out in restaurants, partying on Lower Broadway, and planning big Thanksgiving gatherings as if everything is normal. It's very frustrating to see people not taking this virus seriously. One of the simplest things people can do to help us healthcare workers is to wear a mask. The recent studies from Vanderbilt have shown that masks and mask mandates work. The study showed counties without mask requirements have higher hospitalization rates and twice the death rates from COVID. Governor Lee does not seem to understand what we as frontline physicians are dealing with every day. And so I would like to extend an invitation to you, Governor Lee, to visit my emergency department or any of the emergency departments in Tennessee, where hospitals are quickly reaching or already are at capacity. Come and see what full COVID floors and ICUs do to the emergency departments, filling up our treatment rooms, overflowing the waiting rooms, and forcing us to divert ambulances elsewhere. You need to spend time talking with physicians and nurses about the stress we experience when we have to treat an emergency in the hallway or the waiting room because all of our treatment rooms are full. Governor Lee, you aren't responsible for COVID, but you are responsible for leading us through this crisis. As a frontline physician, I implore you to listen to the health experts and make the tough decisions. I understand that making masks mandatory is a tough and likely unpopular decision, but it's the right decision and one that will save lives. You will see this if you visit the hospitals and see firsthand how your current strategy is not working. We desperately need your help. I join my colleagues today pleading with you to help us do our job and protect your constituents by issuing a statewide mask mandate. Physicians and health experts have been saying for months that this is what is needed in Tennessee. It's time to listen to us and to them. We can defeat COVID, But it depends on us having a statewide coordinated plan and strategy and decisive leadership from you, our governor. Thank you.
Thank you, Dr. Green, for telling us about your experience with COVID. Finally, we will hear from Dr. Matthew Semler, who is currently working in the ICU. Dr. Semler, how are you feeling this Thanksgiving?
Thank you for having me, Dr. Bono. I appreciate it, and I've had better years. So I'm Matt Semler. I'm a critical care physician here in Nashville. I've been caring for patients in Tennessee for the last 12 years. And since March, I've cared for more than 100 critically ill patients in our special COVID intensive care unit. But today I want to talk about Thanksgiving, but not this Thanksgiving. I think I want to talk about next Thanksgiving, because I want everybody listening to picture next year with the friends and family and grandparents and parents and brothers and sisters and neighbors who you want to spend next year's Thanksgiving with, who you want to see around the table. Next Thanksgiving seems impossibly far away right now, right? But it isn't. A vaccine is coming. A vaccine for COVID is coming, and there's light at the end of the tunnel. The reason that's important is because it makes the choices that we all make this holiday season critical. If you want to spend next Thanksgiving with a parent or grandparent or brother or sister or neighbor or friend, then you have to choose how to protect them this holiday season. When I say that, I mean it. In the last 9 months, I've cared for more than 50 patients who died from COVID. A young woman in her 20s all the way up to a great-great-grandmother. And each one of those families is going to have an empty seat at the table this Thanksgiving, right? In the ICU right now, we have a college student. We have a 40-year-old who got COVID at the gym. Multiple family members of our hospitals, nurses, all critically ill from COVID, right? We don't know which of them will be around next year for Thanksgiving. So how do you protect your family, protect your friends, so you can sit with them at the table next year? I think the good news is it's simple, it's free. It's not some fancy wonder drug. It's the simple things we've been talking about, right? Plan a small gathering and save the big family reunion for next year. Celebrate with those you're seeing regularly, locally already, rather than traveling or asking your family to travel. Be outside whenever possible. It's going to be chilly this year, but be outside anyway, right? Put on a coat. Stay 6 feet apart and wear a mask whenever you're not eating, and wash your hands. But to ensure that your friends and your family are with you next year on Thanksgiving, we also need our state's leaders to do their part. Their job's even simpler than ours, right? Governor Lee needs to issue a statewide mask mandate. That's it, right? Tennessee counties where masks were mandated over this past summer now have death rates that are less than half of those where masks were not mandated. This isn't rocket science. It isn't rocket science. There are more patients hospitalized in Tennessee now, this week, than at any other time during the pandemic. And more than 40 other states have already issued mask mandates. So what are we waiting for? If our leaders can set speed limits to protect drivers and pedestrians, we can implement a mask mandate to protect all of us. And it isn't forever. There's light at the end of the tunnel. We have to do these things now to get us to the point that we're all at the Thanksgiving table together next year. So today, I'm going to walk back up to our intensive care unit, which has more patients in it this week with COVID than at any other time during the pandemic. The doctors up there, the nurses are exhausted. We've been doing this for a long time, and we need the support of the community and of our state's leaders. And this Thanksgiving, I'm going to eat a meal outside with a small number of my immediate family members with social distancing and with masks. I hope that you'll do the same. Thank you.
Dr. Semler, thank you so much for your hard work, and thank you for sharing with us your experience today. Thank you to Dr. Green, as well as Dr. Rosen. You know, When I've been through a crisis before, what got me through was feeling supported. And currently, I feel like leaders don't support science and don't have policies that support healthcare workers and essential workers. Leaders have politicized mask wearing and played petty games with government relief funds. Tennessee Governor Lee fails to listen to medical and public health advice, and in doing so, fails to support healthcare workers and get COVID under control in Tennessee. Clearly, Governor Lee, your fend for yourself approach to COVID-19, this health crisis, it's failed. Your hospitals are at capacity. Your healthcare workers are burning out. Outbreaks are closing schools and harming businesses. Your state is in critical condition. You need to change strategies now. You cannot continue to avoid responsibility and leave the burden on businesses, healthcare workers, mayors, teachers, parents, and students to fight this pandemic on their own. At one point early on in the pandemic, Governor Lee mentioned that hospital utilization metrics would drive his decision-making. And clearly, that's not happening. So even if Governor Lee's ears are deaf to our physician concerns, we turn to you, our fellow citizens, to ask for help. To reiterate a question from earlier, how can you help your neighbor? And really, what can you do to help your healthcare workers and your healthcare systems during a crisis? Well, first, wear a mask over your nose and your mouth. Understand you have a responsibility to help control COVID. Your choices that you make impact those around you. When it comes to coronavirus, what happens in your own home impacts what happens in your community. Your travel schedule impacts your healthcare worker's schedule. Your behavior can change the trajectory of this pandemic and can change the course of American history. We urge you to avoid gatherings, especially indoors, that bring together people from outside your own household. Traditional holiday gatherings have tremendous potential to spread coronavirus. Canadian Thanksgiving did worsen COVID case counts in our northern neighbor. Though this moment of expressing gratitude is scheduled on the calendar, we should always be thankful for the gifts of one another and do our part to help each other during this crisis. We need everyone in this battle against COVID. We need Governor Lee, and we need you, our fellow citizens too. We need to fight for every inch right now. Again, we reiterate, Governor Lee, we need a statewide mask mandate, and we need you to get with the times and get in the game. And so that will conclude our prepared remarks for today. We will now open the floor up for further discussion and questions.
Okay, first we have Blake Farmer. Blake, you should be unmuted.
Great. Yeah, it's a question for Dr. Rosen or Dr. Green. We keep hearing about hospital staffing being the bigger concern than sort of like having enough beds. And so I'm curious at your all's respective hospitals what that's looking like at the moment. Is that just nurses working a bit more overtime, or actually not being able to staff all the beds you'd like to at this moment? Like what does that look like right now?
So at my hospital specifically, I know for a fact that our capacity is limited by our nurses' staffing abilities. And a lot of them do work overtime, but there's a limit to how much overtime someone can work. And it's very taxing, not just physically, but emotionally, to take care of COVID patients. We were short-staffed as a hospital before COVID even hit. The nursing shortage was not something that was, a mystery to us. But this pandemic has made it a lot worse, especially when nurses are out quarantining because they've been exposed either at work or outside of work. And so it really grinds everything to a halt. But I know for a fact that nursing staffing shortages have affected our capacity at my hospital.
Next question is from Tony. Tony, you should be unmuted.
Yes, can you hear me?
Yes, go ahead.
Oh, my question is, has there been any actual conversations or contact with the governor or his office regarding the need for a mask mandate?
Frequently, communications are sent to the governor to ask for a statewide mask mandate. I would add that even the Tennessee Education Association has petitioned the governor for a statewide mask mandate recently.
And currently over 3,500 Tennesseans have sent emails asking the governor to do it as well in the last few weeks. Next, we have another question from Blake. Go ahead, Blake.
Another question that's sort of related to hospital capacity, and that is, are you all having to divert patients at this point? I mean, we've heard of a couple of hospitals, but like, I guess I'm having difficulty putting this in sort of like concrete terms for listeners. So like, how close are we getting to a point where no, you can't just roll up to the ER and expect that you'll be seen anytime soon?
So I will say that having worked here in Nashville for over 10 years at the same hospital, I don't recall almost ever that our hospital had been on diversion prior to this year. In the last probably month to 2 months, we have been frequently on diversion, meaning that we don't take transfers from other hospitals. We try to send ambulances to other hospitals because we have no beds available. Sometimes we have no ICU beds available. As we talked about before, a lot of that has to do with nursing staffing shortages as well as volume. And the combination of those two factors is quite frankly already overwhelming most of the hospitals in Nashville. And I think that's going to continue to get worse, unfortunately. Unless
are you all having to bring in doctors from out of town or contract nurses from out of town? I hear that is more difficult than it was at one point.
I can't speak to that exactly. I know that my hospital has not been bringing in other doctors into the ER. However, I think in the past they had been able to bring in particularly nurses from other areas. Unfortunately, right now, COVID is so widespread that I know they're having trouble getting nurses from other areas.
And you all talk about working Thanksgiving Day. I mean, would you all normally not be working Thanksgiving Day? Is that unusual at all for the three of you?
Go ahead, Dr. Simler. Looks like you.
No, I can speak for Jess and I that it's not uncommon for us to work a holiday. I would like to, I think two of those points that I can add to, though, that might help clarify what situation we're in for listeners. The first is about the nurses. So nurses who come from elsewhere are often referred to as traveler nurses. And as Jess was saying, the problem right now is that we have doubled the number of ICU beds we're trying to staff because to make this new COVID ICU, and as most hospitals in Tennessee have. And so we need twice as many nurses to do that, but everywhere in the country has done that. And so you can't get nurses from parts of the country that are not having high rates because there are not those parts of the country now, unlike when New York had its infection. So I think when New York had these massive surges, physicians and nurses from other parts of the country were available to go support them, and that's not there now. We have activated a second team of physicians to staff that unit just in the last week, and so we've kind of called our emergency team. Those are all from within our hospital. And then I think the second question you had of when will we hit the point that we're on diversion, or hospitals generally in Tennessee are on diversion. And I think that point was maybe a week or 10 days ago that we hit that point. And so in our intensive care unit, in the last week, we've gotten patients from Arkansas, Kentucky, west from Virginia, the western part of Virginia, Alabama, and all of those patients are bypassing 3 or 4 different hospitals that are closed on the way to our hospital because each of those hospitals is on diversion and closed down. And so I think we're already in a state where the vast majority of our patients now in the intensive care unit are not coming in through our emergency department. They're being sent hours to be at our hospital because all the hospitals between here and where they present to the emergency department are closed or are on diversion.
Thank you, Dr. Simler. And you, when you all talked about, you and Dr. Rosen are related or something, correct?
Yes, we're married, related by
Okay.
marriage. Yeah.
And I'm sorry I don't mean to command this. I just wanted to make sure you all are not speaking for your hospitals, but Dr. Rosen, you're St. Thomas Rutherford, Dr. Green at TriStar Skyline, and Dr. Simler at Vanderbilt. Are those accurate?
Yes, those are the hospitals we are not speaking for.
Got it.
I'm actually primarily at St. Thomas Midtown,
Oh, great. Thank you.
not speaking for that hospital.
Yes, only speaking for myself.
Right. Not seeing any other questions on the line. So doctors, if you'll want to close us out, I think that's a wrap.
Guys, thank you for your time today. Thank you for all you do. Thank you to the reporters for keeping us going and always searching for the truth. So thank you for all you do. It takes us all to make the world go round.
Thank you.
Thank you.
Thank you.